Telehealth and telemedicine are ways to distribute health-related information by electronic devices. They allow long-distance patient and clinician contact, care, advice, reminders, education, intervention, monitoring, and remote admissions. When rural settings, lack of transport, lack of mobility, epidemic or pandemic outbreaks, decreased fundings, lack of healthcare staff, etc., telehealth may bridge the gap, as well as provide distant learning meetings, supervisions, and presentations between practitioners. What is the difference between telemedicine and telehealth? Telemedicine only includes clinical services, such as doing clinical diagnosis, providing prescriptions, or monitoring treatments. Telehealth is a bigger concept and includes telemedicine plus other issues like continuing medical education, discussing a case between specialists by video conferencing, providing health education on internet or social media, as well as collaboration between health research centers. Telemedicine requires good internet access by participants, and it can be presented in the next formats: live video, which is synchronous, store and forward, asynchronous, remote patient monitoring, and mobile health. Store and forward involves to share medical data like medical images or biosignals from patients to a practitioner, and it doesn't require the presence of both parties at the same time. For example, sharing skin images to a dermatologist, sharing glucometer registrations, sharing X-ray, CT, or MRI, etc. The store and forward process lets provide an effective approach to diagnosis and treatments in conditions that doesn't need a physical examination as a rule. Remote monitoring, also known as self-monitoring or testing, enables medical professionals to monitor a patient remotely using various technological devices. This method is primarily used for managing chronic diseases or specific conditions, such as heart disease, diabetes mellitus, or kidney failure, home-based nocturnal dialysis. Real-time interaction, known as electronic consultations, provides real-time interactions between patients and providers. Video conferencing has been used in a wide range of clinical disciplines and settings for various purposes, including management, diagnosis, counseling, and monitoring of patients. Can be replaced with phone calls in lack of internet situations. Some experimental procedures and surgeries has emerged along internet development. There are clinical centers that have implemented remote surgery systems with a surgeon in a hospital commanding a robot located in another place, even in a different city or a different country. The robot reproduces the surgeon movements while he sees the operating table throughout a multi-camera system inside and outside the patient's body. Telemedicine has an important impact to provide healthcare to people. It can increase health promotion efforts, extending providers helping to homes or private and safe environments. Currently, telemedicine has been a crucial matter in a pandemic situation. It allows increasing health promotion, especially in countries with no professional resources available. For example, Australian Breastfeeding Association and a tech startup called Small World Social help new mothers learn how to breastfeed. Doing medical attention approachable to patients allows to increase the quality of the interventions. If medical staff can be closer to patients, they can give them more support to treat their conditions. Furthermore, they could give health educations to patients and their relatives, oriented to prevent complications. To prevent has a big impact in the quality of healthcare, and it is the most effective interventions to avoid some chronic conditions or to delay its complications. In a UK telehealth trial done in 2011, it was reported that the cost of healthcare could be dramatically reduced with the use of telehealth monitoring. Telemedicine consumes fewer public resources and requires fewer people to operate it, with shorter training periods to implement initiatives. It is predicted that telehealth will replace many consultations and other health interactions. Nevertheless, it cannot yet fully replace a physical examination. This is particularly true in diagnostic, rehabilitation, or mental health. Virtual medical treatments also carries potential decrease of human interaction between medical professionals and their patients, an increased risk of error when medical services are delivered in the absence of a registered professional. Furthermore, protected health information may be compromised through electronic storage and transmissions. We need new regulations and legislations to provide to patients safe health remote cares with confidentiality guarantees. Besides, many families and individuals in the world do not have internet access in their homes yet.